CDC mask guidelines for children. Hello dear viewers, today we will talk about the recommendations of Centers for Disease Control and Prevention for children. The talk will be in two parts, one advice for students and schools, then two important and basic advice for children in general. Guidance for COVID-19 prevention in K-12 schools. Updated July 9, 2021. Key takeaways. 1. Students benefit from in-person learning, and safely returning to in-person instruction in the fall 2021 is a priority. 2. Vaccination is currently the leading public health prevention strategy to end the COVID-19 pandemic. Promoting vaccination can help schools safely return to in-person learning as well as extracurricular activities and sports. 3. Masks should be worn indoors by all individuals, age 2 and older, who are not fully vaccinated. Consistent and correct mask use by people who are not fully vaccinated is especially important indoors and in crowded settings, when physical distancing cannot be maintained. 4. CDC recommends schools maintain at least 3 feet of physical distance between students within classrooms, combined with indoor mask wearing by people who are not fully vaccinated, to reduce transmission risk. When it is not possible to maintain a physical distance of at least 3 feet, such as when schools cannot fully reopen while maintaining these distances, it is especially important to layer multiple other prevention strategies, such as indoor masking. 5. Screening testing, ventilation, hand washing and respiratory etiquette, staying home when sick and getting tested, contact tracing in combination with quarantine and isolation, and cleaning and disinfection are also important layers of prevention to keep schools safe. 6. Students, teachers, and staff should stay home when they have signs of any infectious illness and be referred to their healthcare provider for testing and care. 7. Many schools serve children under the age of 12 who are not eligible for vaccination at this time. Therefore, this guidance emphasizes implementing layered prevention strategies, for example, using multiple prevention strategies together consistently, to protect people who are not fully vaccinated, including students, teachers, staff, and other members of their households. 8. COVID-19 prevention strategies remain critical to protect people, including students, teachers, and staff, who are not fully vaccinated, especially in areas of moderate to high community transmission levels. 9. Localities should monitor community transmission, vaccination coverage, screening testing, and occurrence of outbreaks to guide decisions on the level of layered prevention strategies, for example, physical distancing, screening testing. Help stop the spread of COVID-19 in children. Wash hands. Make sure your child washes their hands often with soap and water for at least 20 seconds. If soap and water are not readily available, make sure your child uses a hand sanitizer that contains at least 60% alcohol. Teach your child to cover all surfaces of their hands with hand sanitizer and rub their hands together until they feel dry. If your child is under 6 years of age, supervise them when they use hand sanitizer. As a parent, guardian, or caretaker, play an important role in teaching your child to wash their hands. 1. Explain that hand washing can keep them healthy and stop germs from spreading to others. 2. Be a good role model. If you wash your hands as recommended, they're more likely to do the same. 3. Make hand washing a family activity. Practice cough and sneeze etiquette by covering your nose and mouth with a tissue when sneezing or coughing, throwing the tissue in the closest garbage can, and washing your hands after you throw it away. Avoid close contact. Keep your child at least 6 feet away from others who don't live with them and those who are sick, such as coughing and sneezing. Limit in-person playtime and connect virtually with other children. CDC recognizes this pandemic has been stressful to many, so tell us in the comments about your personal experiences with it.